Good afternoon. My name is Brian Carey, VP of Marketing here at Unbound Medicine. Thank you for joining us today as we present to you a series of short discussions regarding the changing nurse education landscape we are all facing this fall. Today, we will be discussing some ways Mount Carmel College of Nursing is teaching students. This pre-recorded presentation will last about 10 minutes. Please feel free to ask questions in the window provided. The speakers will answer the questions and we will email you the responses. The recorded webinar will be shared with everyone via email and uploaded to Unbound Medicine's YouTube channel. Now, please let me introduce our presenters. First, Barbara Rettig. Barbara has been a pediatric nurse at Nationwide Children's Hospital for 30 years, working on a variety of patient units, including the float pool. She has taught at Mount Carmel College of Nursing since 2008 as a pediatric clinical instructor. Barbara was nominated as Ohio Nurse of the Year in 2018 in the academia category and received the Nurse Educator Excellence Award at Mount Carmel in 2019. Joining Barbara in this discussion is Patty Severt. Patty has been a nurse for over 20 years. Most of her nursing career has been spent in pediatric nursing. For the last 8 years, she has taught pediatric nursing as a nurse educator in theory and clinical at Mount Carmel College of Nursing. She's also currently a DNP student at NCCN. Thank you for joining me today. Now, you guys have told me you're doing some really interesting things with case studies. Can you tell us more about how you're using case studies in your class?
I'd be happy to. So one of the ways that we started embarking on this journey of the virtual remote world was case studies that I like to call paper patients. And we use the SBAR format, and SBAR stands for Situation, Background, Assessment, and Recommendation. And this is a communication tool used for nurse-to-nurse communication and also nurse-to-physician reporting. When you call the doctor, you should communicate in the SBAR format. So we like to weave that SBAR tool throughout the undergrad nursing program. So what we did was use a version of this tool electronically for the students, and we developed patient scenarios based on theory content for that specific week, and then also patients that we have cared for ourselves and different patients that we might encounter on the clinical unit.
Sounds fantastic. So my question would be, would this activity translate well into a distance learning situation? And if so, how do you feel that would happen?
So we found that this actually transitioned very well to the online learning platform. We started discussing it as soon as we learned that we would be doing online clinicals instead of at the hospital real person clinicals. So it really opened up a world of possibilities. We could send the students off on their own to research a particular diagnosis based on the scenario in the SBAR case study. And then we would come back together as a group to discuss all the pieces of the SBAR. And we could ask critical thinking questions. The other students could ask questions to gather more information. And it was really helpful then to have that group discussion because then everyone got the same information. When we wanted them to explore further, we could send them back out to do some more individual work and then come back together again to wrap it all up. They really need that critical thinking. That's what we do in real time at the hospital. We have a chance to ask those kind of questions. So we really kind of had to think outside the box to find a way to address those issues in our virtual world. The students could add illustrations as you see on the screen or short YouTube videos to come up with ideas for everyone to see and think about to really solidify at home. The instructors who had a world of experience doing these particular scenarios could interject our real life experiences Many times I would say, well, I had a patient who was 10-year-olds who had this particular condition. Let me tell you about them. And I think that really helps them kind of create that whole picture.
That's fantastic. So what has been some of the feedback that you've gotten from students? Have they enjoyed this type of activity?
So we have really gotten helpful, constructive feedback.
Mm-hmm.
The SBAR paperwork, we were a little, weren't really sure how it was going to go when we initiated it, but the students really liked it. They really liked that independent time to be able to come away and research the information on their own, and then come back together as a group and hear what the other students had found, hear what the other students interpreted as the assessment data and the plan of care. So they really liked being able to work together, as a group as well. Sometimes we would break them out into groups of 2 or 3, and they could work together on certain assignments. And what you're seeing on the screen here was one of our students that some of the creativity, this was not required, but as part of the presentation piece and teaching her fellow classmates, this is what she came up with. And so they really liked being able to be creative and kind of make it their own. So, so they also said that it was helpful. We would share these SBARs. It was a Google Doc, so we would share with all of the students, and they were able to use on their own time for studying for some of these disease processes.
I really think it helped too. Kind of help us determine what students maybe needed more assistance, or to be steered a little bit better in the direction of what resources they could use, or how to accomplish them, instead of just, in the virtual world, it's kind of hard to assess them clinically. And I really think the SBARs helped us be able to do that.
That's excellent. So you were able to assess their weaknesses based on the way that they filled out the case studies.
Yes.
That's fantastic. That's great. One of the, you spoke quickly or briefly about the SBAR format. Have you used different kinds, and why is this your preferred method?
We have used different kinds. We actually started using this form in the clinical area, and this one that we adapted for remote learning is pretty similar to the one we use at the clinical site to get the students thinking about the patient history, their background information, putting together developmental pieces. For kiddos, we need to focus on age and development, and are they meeting milestones, Erickson stages of development. And so it was able to bring those pieces on together. And then also, as they assess their patients, they were able to jot down on this paperwork their assessment data, and then be able to critically think about, okay, as the nurse, what's next? What's your recommendation? What do you need to do? What do you expect? And so that's where the idea stemmed from, is being able to help them connect to the clinical world in a virtual environment, and try to make it as close to hands-on patient care as we possibly could.
Yeah, the recommendation part was key, because they had to learn what would come next, and what am I looking for when I call a physician or I'm giving a report. They need to know, not just I'm going to take what the doctor tells me to do. I need to kind of know that that's the right thing to do. And I think that this form really helped with that.
Fantastic. So we have quite a few people on the line listening to the webinar that they're actually using Nursing Central. I know that you all use at Mount Carmel use Nursing Central with these case studies. Can you maybe help them with how Nursing Central can be used within this format, and how do you guys use it?
Nursing Central was key with this activity, and I'm going to tell you why. We use textbooks, we use journal articles, but this was one resource that they could all use and get the same information for this assignment, and really learn to navigate the nursing process by, the assessment and the interventions and the evaluation piece, because Nursing Central has all the parts and pieces of this. For example, they could simply type in the search bar if they were looking for muscular dystrophy. And all of the information that Nursing Central has about muscular dystrophy comes up right there. Medications, care plan, pathophysiology, signs and symptoms. Or another resource that's one of my favorites is the 5-minute pediatric consult. That can be pulled up. And I like that too, because the students can either use their computer or use their phones. And those 5-minute consults you can pull up on your phone, boom, really quickly, and just get a snapshot, a quick information about the patient before you go off to care for the patient.
Fantastic. Perfect.
Yeah.
Well, that's everything that I had for today. I want to thank Patty and Barbara for the time. And I want to thank everyone else for viewing this brief discussion about the case studies that are so interesting and can be used in distance learning. So if anyone has any questions, any comments, or want to know a little bit more about Nursing Central, please be sure to email us at webinars@unboundmedicine.com. Once again, thank you to Barbara and Patty. This was fantastic. Thanks, guys.